Women who are pregnant and experience complications often require special attention and need rapid medical care during their pregnancy. Dr. Hellen Rodriguez of Pomona Valley Hospital Medical Center tells us about their fast response transport team that goes into action once they get the call.
A maternal transport is when we pick up a pregnant woman and bring her, so she comes as a unit with her baby. Instead of transporting the baby independently, we do the transport before she actually delivers the baby. Mostly patients that are going to deliver prematurely, whether it is because they have gone into labor or because they have broken their bag of water, or if the mother has some kind of medical complications such as high blood pressure, which may have been caused by the pregnancy, or anytime that there is a maternal medical complication, such as bad diabetes or problems with the lungs, the heart, then those mothers come over here because we have all the subspecialists that are necessary in order to appropriately manage that patient. In our program, we have a team that is specially trained to evaluate the patient. So we actually send our team out to the referring facility. We evaluate the patient over there, and then our own team transports the nurse. So they come in the ambulance or the helicopter, whichever way we're transferring, they're actually accompanying the patient. And we actually have a special certification for the nurses that go to maternal transports, where they're trained not only in ACLS, but they also are trained in all sorts of high-risk problems that can occur on pregnancy. So they can acutely evaluate the patient while on the phone with a perinatologist. So what we're trying to do is get the mother here before she delivers the baby. And if we get a call, the mother is too far along in her laboring process, it may be too long to just bring it down by ground. By adding this helicopter transport, we're going to be able to get mother out here within 12, 13 minutes, even to some of the farthest places that we have gone so far. It is important to transport the baby inside the womb because that is the safest mode of transport for the baby. There's lots of data that shows that if you deliver a baby where it is going to be taken care of, those babies do much better. They're more likely to survive and more likely to survive with less complications if they get taken care of at the place where they deliver.
Dr. Rodriguez shared one story with us.
My favorite story was a baby that was really quite premature out in the desert. And they thought that the baby was going to deliver very shortly. So we transported the patient here. And interestingly, this patient had a medical complication where it was required that she get some medication to protect the baby from developing problems after it was born. And because we were able to get her here, keep her pregnant for an additional several days, we got her on board the medication that she needed to protect the baby from getting an infection later on. And so that baby is actually doing really well. We've got some feedback from the parents, so that was one of our really good stories. Part of our mission is to make sure that everybody out in the community, whether or not they're close to a regional center, understands the importance of delivering the babies at the regional center. That is part of our mission. We're planning on going out there and doing simulations with them, but in the meanwhile, at least every 3 months, we go out there to do education.